Welcome to our today's universal topic, understanding the basics of depression, knowing, learning, depression. What is depression? For real validation to this topic, please focus only on the content. Kindly ignore my lacunas in pronunciation, tone, expression, accent, grammar, my looks, and even this video's background. For the content of this video, please ask, do you know what depression is and why knowing, learning, and understanding depression, even if you have never been depressed, is going to help you? Are you depressed? Have you been depressed ever? Do you have someone you love and care for who is going through or had been depressed? Even if none of this is true for you, please learn about this, as you may not know, but you could one day might save someone's life you care for most. Now, accept that a depressive episode may occur from time to time to people, even to you. There are a lot of actions we can take to lessen the severity of our depression. It is possible to manage symptoms with treatment and positive changes such as lifestyle changes, medication, and therapy. We can all make small but meaningful changes to our body, our mind, and our environment, which are within our complete control. This only means that each of us has the power to improve our quality of life. Depression for most of the people can be managed effectively. We may also need the right treatment in cases when whatever we are doing doesn't work, the self-help doesn't work, to add better value and expedite the recovery to a manageable level. But please ensure that whenever you seek treatment, you ensure that you focus on creating balance of medication, clinical counseling, behavior therapy, plus most important among them is taking action on your life goals. And ensure that there is a sane and very trusted person who can take care of you not being taken advantage by unscrupulous psychiatrists and psychologists who may prolong the treatment. Unfortunately, there are few, and there are few quacks as well. And sometimes the psychiatrists only use medications to treat without cognitive behavior therapy or any other therapy, and psychologists use only therapy, which is dependent only on one part and prolongs the suffering and increases the cost without really impacting effectively. Now, there are 27 profound basics to know, learn, understand, and deal effectively with depression. First, depression affects different people in different ways. Depression is a widespread and genuine mental disorder, health disorder. Depression is not a sign of weakness or a personal deficiency. People experience depression in different ways. Living with depression can be difficult, but treatment can help improve your quality of life. Clinical depression or the depressive disorder is a mood disorder that causes distressing symptoms that affect how you feel, think, and handle daily activities such as sleeping, eating, walking, or interacting with others. Everyone feels sad or low sometimes, but these feelings easily pass with little time. Being sad is not the same as having depression. Depression is different from sadness or grief and bereavement. Grieving process is unique to each individual and has some common elements which share some features of depression. Both grief and depression have intense sadness and social withdrawal. In grief, it is for short period, and in depression, it can last for months, even years. Grief is not pure pain 100% of time. When we are grieving, we also get reminded of the happy, positive, and joyful memories if we had with that person we were attached with. In grief, happy and sad, both moments keep triggering the other emotions. Whereas in depression, the melancholic mood and ability to have fun and enjoyment decreases perceptibly. While grieving our self-esteem does not get impacted, whereas in depression, feelings of worthlessness, not deserving to live, and self-pity becomes very powerful and controlling. As part of the grief cycle, many people have this illusion of joining their departed loved ones or talking with them. But in depression, suicidal thoughts are focused on ending one's life. Although grief and depression are different, some types of shocks and grief, like death of a loved one, losing their job suddenly, being assaulted or molested, or any other disaster, can turn into depression. Depression and anxiety are different, even though, like grief, they have several similar symptoms. Depression is not a normal part of growing older, as it often gets undiagnosed and untreated in older adults. Depression should never be taken lightly. Depression is different from the mood fluctuations that all of us experience on day-to-day basis, especially when you're going through a phase of intense change. Depression can be temporary or can last lifetime. In some people, treatment makes their depression go away completely, although almost all treatment can make managing symptoms less tedious. There are effective psychological and pharmacological treatments available for moderate to severe depression at many places. Managing depression requires some do-it-yourself actions, medications, if the diagnosis warrants it, plus the right type of therapies. Depression is different from usual mood fluctuation happening due to changes, stresses, and chemical imbalances, and due to medication and short-lived emotional upheavals. If you have the symptoms of depression consistently for more than a couple of weeks, all the time, on all these days, then you might be suffering from depression. Depending on few factors and severity of symptoms, depression can be categorized as mild, moderate, or severe. Depression can be with or without manic episodes. Many of the people have relapses and can become chronic depressive when they are not treated effectively. Long-lasting depression, both of moderate as well as severe intensity, is considered a serious condition requiring immediate attention, care, and treatment. In the mild cases, it can hamper day-to-day functioning, and in the most severe form can even trigger suicide. Countries like India, we have almost 1 out of 6 people who require treatment for mental disorder but don't get. Because of many reasons why in India people don't go for the treatment and don't get it. I have mentioned 13 reasons which can exist in many of the developed countries as well. The main reasons are lack of awareness. In India, everything, when people have got mental disorder, it is categorized into only one: madness or pagal, being pagal. It is a big social stigma and a taboo subject. Closed and loved one of the depressed person go out of their way to hide the symptoms and the person. Lack of resources, money, finances, even the treatment providers, therapists, lack of trained healthcare providers, overwhelming urge to contact because their ads are very, very overpowering, and easy availability of quacks everywhere throughout the country. Very few super specialists, psychiatrists, and psychologists. I am having a tough time locating one right in Delhi. Limited tools to diagnose accurately. Huge expense because therapies cost a lot and it takes a long time. Few specialists choose to prolong the treatment to increase their profits. It is not to say that there are not good psychiatrists or psychologists available. Most of them are, but few black sheeps also exist like any other profession. Wrong people entrusted with treatment. Disorders are too often misdiagnosed and prescribed antidepressant which may work for a few days but doesn't work.